Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. If you're new around here, my name is Sarah, and this podcast is a place where we have honest conversations about infertility, pregnancy loss, pregnancy after loss, and continuing to find hope through our grief. Today's episode is inspired by new research that looked at a question that so many grieving parents ask. Can support after pregnancy loss actually make a difference? Whether it's through a support group, counseling, peer support, an online community, or any other type of bereavement program, many parents wonder if reaching out for support will really help, or if nothing can make this kind of grief any easier. Today, we're going to talk about what this research found, what it didn't find, and why I think it matters. Before we dive in, I do want to mention that the research I'm discussing is a systematic review and a meta-analysis that was presented at a scientific conference. As with all research, we'll continue learning more as additional data becomes available, but I thought these early findings were important enough to share because they address a question so many of us have asked. As always, this episode is for educational purposes only and should not be taken as medical advice. Why this research matters. Well, pregnancy loss affects millions of families around the world, yet emotional support after loss can vary dramatically. Some parents are immediately connected with counseling and support groups. Others leave the hospital or doctor's office with very little guidance about where to turn next. Researchers wanted to better understand whether community-based psychosocial interventions can improve emotional well-being after going through pregnancy loss. Community-based intervention simply means support that's provided outside of routine medical care. In the studies included in the review, that included approaches like peer support, bereavement programs, counseling, online support, and other programs that are designed to help parents cope after going through miscarriage, stillbirth, or other forms of pregnancy and infant loss. So how did the researchers study it? Well, it wasn't a single research study. It was a systematic review and meta-analysis, which is considered one of the highest levels of evidence because researchers gather all of the available studies that meet specific criteria, and then they analyze the findings. So the researchers searched 6 medical databases for studies that were published through March of 2025. They ultimately included 17 studies, which involved a little over 1,200 bereaved parents who had experienced different kinds of pregnancy or infant loss. Most of the studies were conducted in high-income countries, and many of the interventions were delivered digitally rather than in person. What did they find? So the first finding was encouraging. When the researchers combined the available evidence, they found that community-based interventions were associated with a small but statistically significant reduction in perinatal grief. They also found a statistically significant reduction in depressive symptoms. However, the researchers also noted that the results for depression varied considerably between the individual studies, meaning that more research is needed to better understand the exact size of that benefit. When they looked at anxiety, the findings were a little different. The review actually did not find a statistically significant reduction in anxiety across the studies that were included. Now, that doesn't mean that support can't help with anxiety, but it means that based on the evidence available in this review and with these studies, that researchers couldn't conclude that there was a consistent benefit of this for anxiety. So it is also important to understand the limitations of this review and these studies. One thing that I do appreciate about this particular review is that the researchers were careful not to try to overstate the findings. The interventions included in the review varied and were not all the exact same. Some involved peer support, others involved counseling, or sometimes more structured bereavement programs. And there was also some that were online versus others that were offered in person. Because of those differences, and because there are still relatively few studies in this area of loss, the authors concluded that there is more high-quality research needed to draw larger conclusions. Now, I know this is a really common conclusion in medical research, especially in those areas that haven't received enough attention, like infertility and loss. So why does this matter? Well, one of the biggest takeaways for me isn't that researchers found one perfect solution. It's that they're continuing to study something that bereaved parents have known for a long time, that emotional support matters. Whether it's through a local group, a therapist, an online community, a bereavement organization, or even simply connecting with another lost parent who understands. Feeling supported can be an important part and an essential part of coping after going through loss. If you're looking for a place to start, I'd also encourage you to check out Chasing the Rainbows. They offer support groups for bereaved parents, and I'll include a link in the show notes so you can learn more if that's something you're interested in. The research doesn't tell us exactly which type of support is best for every person, but it does suggest that community-based support can have the potential to reduce grief and depression for many bereaved parents. Now, the review doesn't say that joining a support group will eliminate grief. It doesn't say there's only one type of support that works for everyone. And it doesn't suggest that healing follows the same timeline for every parent. Grief after pregnancy loss is a deeply individual and personal thing. What helps one family may not be the right fit for another. But what the review does suggest is that emotional support deserves to be part of the conversation after pregnancy loss. If you've ever wondered whether reaching out for support is worth it, I hope today's episode gives you permission to consider it. Not because anyone can take away your grief, not because healing means forgetting your baby, but because you deserve to walk through this journey with people who understand. One of the biggest messages I took away from this review is that emotional support shouldn't be viewed as an optional extra after pregnancy loss. While more high-quality research is still needed, the evidence we have suggests that compassionate community-based support may make a meaningful difference for many bereaved parents. And for those of us who have experienced this, we know this is true. Before we wrap up, if you'd like to read more about the research we discussed today, I'll include a link to the study in the show notes for the episode. And as I mentioned, I'll also include a link to Chasing the Rainbows if you'd like to learn more about the support groups they offer. I always want these conversations to be grounded in evidence, so I encourage you to read the research for yourself and discuss any questions you have with your doctor. Thank you so much for tuning in, and remember, we are all in this together.